worried yesterday to hear the tone of his first address that appeared to be conflating the new bill that Sally's talked about with social care reform, because they are absolutely not the same things, and we need to have that priority on social care.
And Patricia, Marquis, from the perspective of the Royal College of Nursing, in the end, does it all come down to funding?
Yes, it does, but it actually comes down to workforce. And so I would follow on from what's just been said about the social care workforce. We need the same focus on the NHS workforce. And from my perspective on nursing, we've got massive gaps in our nursing workforce. We need an imminent and substantial pay rise, which we believe is about to be announced. A pay rise is about to be announced. We ask the government to make sure that that is substantial to protect the workforce, to enable them to deliver the massive, huge amount of work that is going to be required for the NHS to recover from the last 18 months. So for us, the priority has got to be about the workforce. Without the workforce, you won't be able to deliver any of your health or social care services.
And how do you get that workforce, Patricia? Because is it just a question of levels of pay and conditions? Because after all, we've had some ministers saying, well, we're not interested in bringing in foreign workers anymore. We can grow our own, as they put it.
So we absolutely need to continue to attract more people to work within the NHS and social care. And part of that has got to be pay. And it also is the other terms and conditions that people, work for. Primarily, however, people in health and social care want to be able to do a good job. They want to be able to deliver the care that people need. And to be able to do that, there does need to be enough of them. So looking after the workforce, attracting the workforce into the workplace, including those from overseas who have delivered for the NHS since its inception and are a really critical and key and excellent part of the workforce. All of that needs to be brought together and continued to enable everybody to be able to deliver what the public of the UK is going to need over the next few years.
Now, Sally Warren, you were nodding when we were talking about social care. Is there any chance, do you think, that there will be an integrated national health and social care service? In other words, that the payment and indeed the status of the people working in those two sectors will become synonymous?
So I don't think so, but also I'm not quite sure that is what we would want anyhow. So what do we want out of the social care system? Our social care needs are very different to our NHS and healthcare needs. So I think there's a lot of principles that we'd like to see applied from the NHS to social care. So we'd like our workforce to be well recognised and rewarded. We'd like it to be a good career to work in. We'd like people to be confident that social care will be there. But social care is also some of its real strengths at the moment. It's rooted in communities and individuals. It's delivered by thousands of small organisations who are really able to shape their services around the people they support in a way that the NHS's big institutional care has less been able to do. So I think really what we want to do is bring out the best from some of the principles around the NHS and bring that together with some of the best principles and reality about social care to have a health and social care system that, whilst they might be different, work closely together to mean that those of us that do need to draw on both the NHS and social care are confident that that's joined up care, well integrated and meeting our needs.
Patricia, do you have any idea at the RCN of how you'd like social care policy to develop?
I think very much as has just been described, social care policy needs to reflect the needs of social care, but actually much closer integration with health is absolutely vital. And that's been clearer over the last few months with COVID, that actually it's essential that our services are joined up, that they're all well funded, that they're all well staffed. And that's the really critical thing. And it's a difficult one. We know it is. It's been in the too difficult box for too long, for too many people, but we now need to really bring focus to that, to fund it properly, to put the structures in place, the policies in place that enable the health and social care sectors to deliver the best for the public.
Vic Rayner, is there any way we could learn from elsewhere where perhaps they have managed to develop this system? I mean, Scotland, the Scottish government claims that it's managed